Schakowsky was elected to represent Illinois' 9th Congressional District in 1998. After serving for 8 years in the Illinois State Assembly, she is in her 11th term. Schakowsky serves in the House Democrat leadership as Senior Chief Deputy Whip. She is a member of the House Democrat Steering and Policy Committee, House Budget Committee, as well as the House Energy and Commerce Committee, where she serves as chair of the Consumer Protection and Commerce Subcommittee and is a member of the Environment and Oversight and Investigation Subcommittees. I'm now going to share some information about Ozarama, who again is Congresswoman Schakowsky's Senior Health Policy Advisor. So Mrs. Ozarama is a graduate of Harvard University, where she received her degree in medicine and Society of African American Studies. She has had numerous experiences in the United States House. She's been in there for 1 year and 3 months, as well as the United States Senate as a legislative aide for health policy. She served in that position for 1 year and 8 months. We look forward to hearing all of the insight that she has. And also because AMSA has done such great work around reproductive health, I have to share that Ozarama did her thesis at Harvard in Black Infertility, the Lasting Disclosure of African American Reproduction After the Civil Rights Movement. And so that is something that is very powerful to me personally and to AMSA as a whole. With that being said, I'm going to turn it over to Ozarama and Congresswoman Schakowsky to share a few words with us on the COVID-19 response that has taken place in the Congress, and then we will go into our question and answer session.
Okay, great. Thank you so much, Isaiah. And I am so happy to be with AMSA today. And I am assuming that you're doing your meeting in 2 days virtually on is it you're going to use Zoom or people? Okay, be careful now. Yeah, that's great. So. This is the most challenging time I think that I certainly remember this country ever going through. It's obviously this huge national security issue where the security of all Americans, of our economy, and so many people who are struggling not only with the disease, the pandemic, but also because they don't know, lots of families don't know necessarily where how they're going to pay for their next meal. And we're getting all kinds of calls ranging from when are we going to get our checks to how am I going to save my business to where can I get food for my family. So I hope all of you are doing well and being careful. One of the things that this pandemic has done that may be a good thing in the end of the day is it has exposed so clearly so many of the problems that exist in our healthcare system, the inequities, and we'll talk about that a little more later. But you know that healthcare availability, accessibility, and affordability to people can be such a huge barrier for lots and lots of people. And we are seeing it play out on a racial tableau as well. And we know that we need to make major changes, particularly when it comes to our public health system. And those of us who are part of the Medicare for All movement, we think that this is an example of why we need to make sure that every single American is covered and has access to the health care that they need, that we all need. So we've done 3 things. We had an emergency bill, not so big in comparison. What is it, 8.3 billion dollars that began to address some of the issues that we face. Some $3 billion that went to development of treatments and vaccines, so some research, $2.2 billion in prevention and preparedness, although that I want to talk about that later, because that hasn't gone so well under the leadership of this president. To help families by extending telemedicine, which I'm sure in your generation of doctors, I think is going to be a very important feature, and supporting small businesses. And then we went on to pass what we called the Family First Coronavirus Response Act. And I did want to talk a little bit about what's in there. Not much, but I had a bill in there that actually provided or supported a bill that had two weeks of paid sick leave, which now looks pretty pathetic right now, right? 2 weeks, and up to 3 months of family and medical leave for eligible workers. And then we went on to the big bill, the CARES Act. And I wanted to mention just one thing about it and what's in it for students, students like all of you who are listening. So we secured more than $30 billion in emergency education funding that would provide for, let's see. Oh, Sarame, why don't you talk about what we're doing for students?
Yeah, it would provide $30 billion in emergency funding that students can access, sort of loan forgiveness as well. And so students no longer would have paused payments for all federal student loan borrowers, which I assume many medical students fall under. They can't be punished with wage garnishment during the length of public health emergency, and they can't get any negative credit reporting for not making these payments. And so we're really hopeful that, students, everyone's suffering economically, but like defaulting on your loans can have a really long lasting impact. And we know medical students in particular tend to have a lot of loans. So that was a piece.
The other things, we help small businesses, what we call the payroll protection program, so that a loan to small businesses would be forgiven if they keep their staff on payroll. And that it has had a pretty difficult rollout. We're making sure that there is a one-time payment that we need to extend, actually, but right now $1,200 for adults and $500 for every child in the household, up to about $3,400 would be available to families. So there are a lot of important things in the legislation, but what we have found is that it's just not enough. And so there's another package of emergencies responses in the works right now. It's being negotiated as we speak today to be able to provide more money and to begin to address the disparities in money and how it's distributed as well, to make sure that African American owned banks are also being able to get some of this money that's put in, that women and credit unions are not excluded, and it's not just the big banks that are able to handle the money. So, and we want to make sure that there is more money for hospitals, and that we raise the SNAP, the food stamp, you used to call it, the SNAP amounts for people to be able to get what they need. We've also been focusing on the issue of congregate living, particularly nursing homes, where we find that these kinds of setups can really spark serious outbreaks, and we've made a priority of trying to make sure that there are the standards in place and the inspections and the rules to make sure that our seniors are safe in congregate living places and as well as nursing homes. So, I want to be sure that I answer the questions that you're really asking and that the issues that you want to know. But I'm also interested in encouraging all of you to be super involved. This is a moment for you as soon to be doctors. You want to be weighing in on the policy questions that affect our healthcare system, particularly, as I said before, our public healthcare system, to make sure that it's working properly. So your activism is so incredibly needed and appreciated. So let's hear what questions you want answered.
And Congresswoman, I just have to say that thank you for sharing that, because one thing that students have been asking so much over the last 4 to 6 weeks is, how can I get involved? How can I make a change? And what you just said is what so many have said, but from you, I think that it'll really mean a lot. So thank you for sharing that through advocacy and using their voice, they can really make a change. And that is something that AMSA always focuses on, trying to uplift our students and letting them see that they can make a change just by simply sharing their stories and providing input to what they feel should be done.
So instead of being, I hope you aren't getting depressed, look at this as a moment of opportunity and an opportunity for you to weigh in and make the changes that we need.
Certainly. And so the first question that I'll start with is pretty straightforward. And the question is Congress working on anything to ensure there are enough tests in regards to COVID-19 and PPE available? Because we know that one of the rate limiting steps to us being able to go back to being able to go out as we were before is making sure that we're able to test individuals. And then we also need to make sure that frontline workers, not just those in the healthcare system, but those folks working in grocery stores, individuals who are staff in prisons, have PPE so that they are taken care of, because any one person that isn't protected is a vector for disease. So is Congress working on anything in regards to these two things?
Yes, Congress is, but I have to tell you that it's been so disappointing when the President of the United States is talking about opening up the economy, opening up the United States, that it's going to be like a rocket, and not really considering what is the scope of the problem. And that's why from the beginning, Nancy Pelosi's message has been testing, testing, testing. But the federal government has pretty much claimed itself to be out of the testing business, believe it or not, and leaving states to handle issues like personal protective equipment and tracking it down and paying for it and finding the vendors all over the world to sell it. It's been one of the most frustrating experiences. Although governors around the country are stepping up, including my Governor Pritzker is doing just a fantastic job, as they are in many places. But here's the thing. We need to insist on more testing if we are going to know when we're going to be able, how big is the problem, and when are we actually going to be able to move forward. So I think states are looking more carefully at how we're going to be providing it. And hopefully some of the actual scientists that are speaking to the president will convince him that as a federal priority, we need to go back to more testing. I believe in the final package that we're talking about, or at least the emergency package, are we talking about money for more testing?
Yeah, every one of the packages actually included money for tests and for personal protective equipment, PPE. I think the problem is, like, no matter how much money the Congresswoman and her colleagues fight for, the president still has to allocate it and to run it and to figure out how to acquire the PPE. So Congress has put the money out there. I mean, part of the problem is supply chain, and we've had issues with that. But another problem is that the White House has struggled to adequately deploy the tests that we've given them money to buy.
Is there anything that students and citizens can do to encourage President Trump and his administration to use the money that's been put forth for the reasons that it's been put forth for?
I think making a really cogent argument about it, putting out a statement by your organization on why you think, as young people and as doctors almost, why testing is so important. If we don't know the scope of the problem, how are we going to be able to solve it? And so I would, make a list, and since you're having your meeting coming up, of what are the priorities that you see, and then communicating them as loudly as you can. And I would suggest public letters to the president, letters to the editor, all kinds of social media, to make the point. And I think you'll find it welcomed by the Democrats and by governors.
Mm-hmm.
Thank you. So our next question is from Avanti. She's one of our national leaders, and her question to both of you is, thank you for being a strong champion on access to affordable medications. This is a very important topic to our organization. It is also very important to our future patients and to the future of medicine. We appreciate all your work pushing administration to ensure that a potential COVID-19 vaccine that was funded by taxpayer dollars is affordable to the public. How can med students at AMSA help you and others in Congress gain additional support to guarantee the public that a potential vaccine will be affordable and accessible to everyone?
Yes, I mean, we've had a little trouble getting the administration people, including the Secretary of Health and Human Service, Alex Azar, and even Tony Fauci said that, well, we have to work with the companies, as if we have to, even though taxpayers have invested well over $1 billion into research and development, with more to come, that the pharmaceutical companies should take advantage of this moment and charge more. I mean, to try and price gouge and make great profits from it. So this is one of the most important things. I think this is why we have a select committee that's going to be stood up soon by the Speaker of the House to look at issues of profiteering, pandemic profiteering going on, to make sure that it doesn't happen. And that's especially necessary in the pharmaceutical field, because we have seen over and over again that unless there are clear regulations, big pharma will in fact try and gouge people. This is not theoretical. We've seen these prices go up beyond the cost that people can actually pay. And we have the names of people who have died because they couldn't afford their medication. There is just nothing more despicable at this time than allowing the pharmaceutical companies to hold us hostage and say, no, we're not going to provide it. Actually, I have over and over again been part of initiatives to say that there should be no cost sharing whatsoever for people to be able to get these medications, the treatments, and ultimately a vaccine. And that in fact, this should be shared with the world, because this is international. And really, until we make sure that we can control this worldwide, none of us in the world will be safe. This is a major, major effort that we have to undertake. We have to be fierce and loud and demanding about this, because otherwise Big Pharma will slip in and try and take as much away as they can.
Right.
Osarama, did you want to add to that?
Yeah, no, everything you said was right. I think another issue is, like, though we pushed to ensure that insurers would cover all coronavirus vaccines and treatments without cost sharing so that consumers were held harmless, now that probably is going to incentivize Big Pharma to price gouge unless we put protections on what they can do in the next package. And the federal government is also going to be buying these vaccines and treatments in bulk. And so the Congresswoman, that's why she's working so hard and fighting to make sure that we won't allow Big Pharma to charge whatever they want, so that we won't give them an exclusive license, so that they control access and control distribution and control prices. So we need both, reasonable pricing from them and transparency, because we've invested a lot of money into these drugs already, and we need to understand what they actually spent on R&D and how they use the government investment, so that we know what a reasonable price really is.
And it's not ridiculous to think that we couldn't set up, and I have a bill along with Senator Warren that would actually say that the federal government can produce drugs. Mm-hmm. It wouldn't be that hard to set up manufacturing once we've done the research and development. And so I think there are options other than to just let the pharmaceutical companies have their way with us.
Yeah. Certainly, and everything that you're saying resonates with our mission in AMSA to allow for equal access to healthcare for everyone. And so with that being said, one thing that we are realizing, and not just in healthcare, but everywhere, like you have said, there are so many disparities being highlighted in bold yellow right now. And so we and AMSA have been fighting for decades and decades for universal healthcare. Do you think that this pandemic is going to be what it took for us to actually reach universal healthcare, whether it's expansion of Medicaid or Medicare for all, what have you? Are we going to be able to take the step to universal healthcare, or are we going to continue to see the bipartisan fighting that occurs when we talk about universal healthcare?
Frankly, inevitably, I think the doors are opened for us. I think the fact that it's so clear that our public health system is seriously inadequate. I don't want to say flawed, because there's so many wonderful people working in the public health sector, but we need to do much more. And I think it will lead to more and more people understanding that healthcare is a right. It should not be a privilege. That we cannot afford ourselves to leave people behind. The people who are left behind are the people who are going to get sick, and they can make us sick. And so even if it's self-interest, that we absolutely need to move more closer to a universal healthcare system. This is not mysterious. Every other industrialized country in the world has figured it out. And the only thing that's really holding us back, I believe, is the greed of the private sector that wants to make it into just a big business proposition for big pharma. So I am optimistic that we're going to be able to make progress. Are we going to be able to move to a Medicare for all kind of proposal, or a healthcare for all in one step? No, I don't think so. But we have to keep our eye on the prize and steadily and with as much urgency as possible move in that direction. And I think the American people are probably ready for it. They, if you want to ask people, what is the big problem before all this happened? What is the big problem? The cost of medication. That's at the top of the list. And now more than ever, it's in the limelight. Yes, so I think we're on our way.
Thank you. So I know that you both spoke a little bit about some student relief to debt in the first stimulus package. Could you speak a little bit more on that? So namely, how can students utilize that? And then also, is there anything in the packages that are being proposed, the next step? Is there anything in there around potentially loan forgiveness for students, especially those students who are now stepping out on the front lines?
Well, look, I just want to say that none of these issues are going to disappear. They're going to be continuing beyond this piece of legislation or the next. I do want to say that in this last bill, in the CARES Act, there was a bipartisan, I did a bill with Republican as well as Democratic support that would make sure that we're doing that the workforce is more diverse, and to be able to make sure that monies are available to actually make that happen. And so I think that's a positive step. Do you want to say anything more about the Empower Act, Sarame?
Yeah, so the congressman introduced this bill it's bipartisan with Congressman Burgess last year. And so these programs are in Title VII Public Health Service Act, and they haven't been refunded since the Affordable Care Act in 2010. So though we appropriated money every year, we haven't reauthorized funding, which, puts the program in a precarious spot. But now that we've signed that into law, that is going to be a huge piece of ensuring that the physician workforce is prepared to, meet diverse communities who are suffering from COVID at disproportionate rates. The bill includes funding for geriatrics training, geriatrics academic career awards, and geriatrics workforce enhancement programs. So those pieces are really important as older Americans suffer from COVID at disproportionate rates, and also pediatric specialties. So, though kids don't suffer from coronavirus as severely as adults, kids who have medical issues are just as at risk as anyone else with medical issues. So that's a really, really important piece. I mean, I think we wish we could have gotten more funding, which is where you guys should come in always to advocate. I mean, if Democrats were running these bills by themselves, we would have done so many amazing things. But I mean, we don't have two parts of the government right now. And so everything that you can do to push the Congress to really ensure these programs are being funded at the highest levels is really important.
Right.
So the next question is, how can students who are kind of in limbo right now, I know we've spoken about the advocacy piece, but how do you suggest they begin to start thinking about jumping in this arena? Because I know that AMSA, we provide a great platform for them to be able to use their voices, but quite frankly, in medical school, your mind is so on the prize, which is graduation and then being able to help your patients. But this fear of advocacy and just using their voice and letters to the editors and op-eds is a bit scary. So I think hearing again from you on that piece would really, really mean a lot to students.
Well, for one thing, it looks like you are part of coalitions that are working on issues. So it's not like you are in this alone, although I do think you do have a very special voice that needs to be heard. But there's a lot of activity on your issues out there right now, and so you want to be. That's one of my dogs, Eleanor. My dogs are Eleanor and Franklin, and of course I'm working at home with them. Yeah, and with Bob, my husband. That you said you have.
Yes.
I mean, but in the meantime, I think there are things that you can do to find places where you can be helpful. And I think you were telling me some of that before we went on the air, of what students are actually doing to ease some of the burden that are on the doctors and the frontline care providers. And why don't you repeat some of them?
Yes, certainly. So I was sharing with the Congresswoman what I've heard from a lot of you. Of course, some of you are helping with childcare of healthcare professionals and those who are working in the hospitals, as well as I've heard of you guys dropping off food to those in the hospitals. And I think that is really great. And so, yes, what you're doing is already excellent. And what the Congresswoman and Orozma shared with us, it is very important for us to use our voices. And so with that being said, Congresswoman and Osamra, we have a campaign called Met Out the Vote in AMSA. And yes, and I'm sure you all are all too aware that in medicine, medical students, residents, and attendings have such a low voter turnout rate as compared to other professions. And unfortunately, healthcare has been on the ballot for so long. And so our goal is to get our students engaged, and we are nonpartisan. So of course we do not support any particular candidate, but we do support issues. And so with that being said, I would like for you to speak a little bit to the power of voting.
Well, if you really want to deal with healthcare, you need to vote. If you want to deal with the issues of racial disparities, you have to vote. All of this, ends up at the end of the day being politics. And so I just can't stress enough the importance of looking at the candidates, bringing your issues into the forefront. There's going to be more debates. You want to try and get your questions on the agenda to be asked at those debates. You can call the networks and as an organization offer some suggestions of what exactly should be talked about. I just think that unless we make some changes politically, we're going to be in serious trouble. And so this is a great moment, a great opportunity to talk about what does a functioning healthcare system that works for everyone really look like? And what do we need to do to get there? We saw in the Democratic primaries, there was all kinds of focusing, I think, getting in the weeds on the issue of Medicare for all. If you want to know the truth, I found that distracting because there really, when you talk to the candidates at that point, there really wasn't that much difference. Like, how do you pay for this? The issue is, do we believe that the United States of America is ready for a time when healthcare is a right and not just a privilege? And what does that mean? What does it look like? In the city of Chicago, 72% of the deaths to the coronavirus are African Americans. And we are, and they are, and African Americans are about 30% of the population. What does that tell us? That there's been a long history of inadequate health care. Of course, it also means, I think, a lot of the people on the front lines maybe not having the protective garb that they really need are often African Americans. And so we can't tolerate those kinds of disparities. And so, I used the word fierce before. I really think that we have to be undauntable, that we have to be, willing to shout it from the rooftops, the kinds of the agenda that you have. It doesn't have to be partisan. It just needs to be out there as a measuring stick of who should be the leader in this country, leaders, because of course we have elections up and down the ballot, so elections are not a side issue; they are central to what kind of country we're going to be living in and what kind of healthcare system we're going to have, what kind of support we're going to have for students, what kind of diversity we will have in the workforce, what kind of protection we have even in the short term for people who are, as much as any soldier heading off to war, people who are heading off to work right now and working with people who are desperately sick or even working in the grocery store, deserve to be protected and be viewed as frontline soldiers in this war against this deadly virus. This is your moment. I'm telling you, this is your century. This is time for your generation to be really clear and involved. And we have seen, you said, I didn't know this, you said that the medical profession and students often don't vote or are low propensity voters. Well, if you really care about your issues, then it's an obligation to get involved, speaking out on issues, and then, of course, bringing that to the polls. And by the way, we're trying to get universal vote by mail, which is so important, so that people don't have to risk themselves or just have the choice. Many states do it already. And so we could use some help in there to make sure Also, that we don't have voter suppression activities that are going on that try and keep certain communities from actually going to the polls and voting. So we have got a lot to do that doesn't seem like it's healthcare, but it really is at the end of the day.
Certainly. And I just have one final thing that I know many people have been throwing around. And, while we are nonpartisan, obviously we see what's happened. Joe Biden will more than likely be the Democratic nominee now. And Bernie Sanders stood for a lot of things. And Medicare for All was
Yes.
one of them.
Yes.
And so there are some individuals who feel like now, because of this, Medicare for All won't happen, or we won't reach universal health care. But one thing that is very important, and that sometimes we feel people fail to realize, is that the ACA might not be everything that it could be, but if we take that away, we would be even worse off. So I was wondering if you could just speak a little bit to the overall idea of, yes, it's an increment, it's a stepwise process to get there. It's not going to just happen overnight.
Yes, and actually, this crisis may speed it along, which is sort of a silver lining, perhaps, in a very dismal sky. But I absolutely believe that this candidate absolutely is Joe Biden. He was endorsed now by Bernie Sanders, and today by Barack Obama. And the contrast couldn't be stronger. At this moment, the President of the United States is hoping that the court will undo the Affordable Care Act altogether. There's been a lawsuit in the state of Texas that would eliminate everything, that it would just take away, it would pull down the Affordable Care Act, which I knew as someone who had the privilege of being on the committee that helped to write the bill. We wanted a public option. We weren't able to get it into the bill. But there are so many things that we can do as we move toward universal health care. Quickly, we could do it, and I think that we will find that, and there's many of us, by the way, in the progressive movement that are trying to work with the campaign, with the Biden campaign, and with progressives to make sure that there's excitement about voting in this upcoming election, and to picking somebody who's going to move forward on healthcare. I think we're going to be there. And you know what? You're going to be around a long time. I'm not saying that it's going to take a long time, but you're young, you're energetic, and this can, the next few years can belong to you if you take advantage of that and fully participate. But I'll tell you, if at the end of the day, it looks like, well, young people didn't show up anyway. We don't need to cater to the issues that they're raising because they don't turn out for elections. You don't want that to happen either. You want to make sure that your participation is robust and strong, and it can make just an enormous difference in our country.
Thank you so much, Congresswoman Ann Ozarama. I think that everybody has learned so much. I know I've learned a lot by listening and interacting with you two tonight. I just want to say thank you again so much for joining us. And I think this is a great lead up to our convention. So for those of you listening, you know that our convention is April 16th. Through the 18th. Our very first day is our advocacy day. So a lot of things that you heard tonight, we will be talking about more specifically when it comes to COVID-19. We're going to be advocating around making sure there's affordable access to the vaccine.
Let me say one more thing. Phone calls to legislators really make a difference. You would be surprised. Every week, I get a record of who has called. 10 calls, just 10, can trigger a discussion about an issue. And I am telling you that these phone calls, reaching out to members of Congress, really, really make a difference. So it's not just about the White House. It is about individual members, because they are getting the same calls as Republicans or Democrats that I'm getting, which is help. We need help, and we need access to health care. So that's another really important strategy. And I just wonder if it would be all right if I just ask if Osarama wants to say anything in closing as well. You know, my Harvard graduate and expert on healthcare. I don't know what I would do without her. So maybe you'd like to say a few words to these folks of your generation.
Well, no, Jan, it's an honor to get to work for Jan Schakowsky. She's the best. But I also wanted to mention the phone call part. You should, right now, you might not get a call back immediately, or you might have to leave a message, but we are hearing all of those messages and we are responding to all of them, especially in our office. So don't be discouraged if someone doesn't pick up your phone call right away. I think, you know, working in policy, it's easy for me to think about like, oh, why wouldn't you care? Of course you should care about this. This is the most important thing. How could you think about anything else? But obviously, I think when you're doing other work, when you're in medical school, when you're working on a hospital floor, when you're really busy, it's easy to sort of just say like, I'm not involved, I'm not invested, this doesn't impact me. But I hope the one thing that this crisis will tell everyone is like everything that we do in Congress every day, all these initiatives directly impact everyone. And it's so important that we hear from people who are being impacted, and so that these bills aren't being crafted by, you know, special interest groups or, you know, certain organizations, that we're hearing from workers, healthcare workers, students, physicians. And, you know, that's who we listen to. That's who Congressman Schakowsky listens to. But I think other members, I think you have to speak out and make sure that they hear you. That's really, really important. I think like not every office is built the same. And so you might have to push, but I think most all offices, you know, listen to their constituents and want to hear your voices. And I think as a health staffer, hearing from physicians is very different than hearing from other people. Like I think I really respect your voices when I'm doing my work, because I know that you're seeing patients every day, know that you're seeing how our policies are implemented on the ground, and that is so essential for us. So don't think that your voice doesn't matter, is what I would say. And I'm also always happy to, you know, Isaiah has my contact if anyone has any specific questions about the policies, what the loan will apply to you, or if, you know, you'll get funding through X route, we're happy to answer those. So feel free to reach out via email. And I'm happy to share my email through Isaiah.
Thank you so much. And I feel like you guys really just set up our advocacy day. And I'll share with you, I'm proud to share that on Thursday afternoon, our attendees will be having calls with senators in their offices, as well as some people on the House side as well. So we are going to use our voice and speak to them as much as we can.
Nice. And consider us your partners. We're happy to work with you. We're happy to help in any way that we can. So good job. Thank you. Have a wonderful, wonderful convention.
Thank you so much.
All right, good luck.
Have a good evening, everyone. Bye.
Bye.
Bye. Okay, I know how to